Okay, so good morning, everyone. Today we will continue on our discussions about these cases. First of all, this is a 63-year-old male patient presented with lower limb weakness and pain and things like that. تفضل. MRI, dorsal MRI was requested for him. Dorsal MRI, sagittal view, T2 weighted images, excellent.
The upper dorsal spinal canal stoma, but
Salt.
there's some abnormality. We see in the sagittal view there's some hyper intense
There is a T2 hyperintense
mass.
mass.
It's like lesion I see in the T2 in the sagittal view.
Good, excellent.
And, I don't know where's this location, but in the dorsal.
Okay, it's in the dorsal spine, in the dorsal region.
And here.
This is T7 and T8 by the way.
Ah,
أعطيك إياها لا تحسب لا تدوخ.
okay. We
زين.
see it in the axial.
Okay.
In the myelography there is some stenosis.
There is a cut in the myelogram at the same corresponding region. انزل شوية. Just take another sequence. This is T2, T2. Go to the T1. No, this is T2. Yeah, T1. خلينا نشوف.
It's the same with the hyper intense.
Hyper intense lesion at the body of the vertebra T7. And what about the one in the T8?
This one,
Yeah,
it's hyper intense.
it's also hyperintense. So we have two lesions at T7 and T8, both of them hyperintense on T1 and T2 weighted images. What does that indicate?
It's fatty.
It contains fat, which means
Modic type 2.
لا مو modic. Something modic happens at the vertebral end plate, not at the vertebral body. Modic is usually linear, not rounded. What do we have in the vertebral bodies that's rounded, common, asymptomatic, usually asymptomatic, and hyperintense on T1 and T2? Hemangiomas. So these two are most likely to be hemangiomas. If you want to confirm hemangiomas, what do?
Fat suppression.
You do a fat suppression. What will happen in fat suppression?
It's being suppressed.
It should be suppressed. Good. That's all. What else do we have? يعني راح اجيب لك كيس على مود هيمنجيوما vertebra.
أكيد يعني ما فتش.
زين. حتى مو ما تليق بالمقام. زين. What else?
I think there's some here.
Yeah, there is intraspinal lesion.
Intraspinal lesion.
There is intraspinal lesion. So when we have intraspinal lesion, what are the things that we need to look for? First of all, signal on T1 and on T2. It looks
T1.
on T1 it's iso to hypo.
You mean this one?
Oh, yeah, this one exactly. And on T2
T2 hyper.
it's hyper. First, second, location. It's at the level of T7 or T8, something like that. Is it extradural, intradural, extramedullary, or intramedullary?
We see it by the contrast.
You need to go to what
Contrast.
before contrast? See the
Axial.
axial.
Axial, sorry.
You go to axial to look for where is it located and where it's originated from. Let's go see it. What's this first? We have T1. Okay, yalla, T2. Go, no problem. Where is the lesion?
This is the hemangioma.
This is the hemangioma, exactly. This is the spinal cord, and this is the lesion. لا صعد. Okay.
This one.
This one. What do you see here?
We see there's paracentral mass compressing the spinal cord.
Intradural, extradural, intramedullary. Choose. It looks like dural, extradural.
Dural but extramedullary.
Okay, it's extramedullary because it's compressing the spinal cord, not replacing it. You can see the spinal cord here. compressed to the other side. First. Second, what else is distinguishable here?
It's going to the extra.
It's going through the exit foramen
Exit foramen
to the
outside.
extra
Yes.
spinal location. So that's what we call what?
Yeah,
Dumbbell
it's-
tumor. Dumbbell. مثل dumbbell. Dumbbell small training. Two parts. Part inside and part is narrow, the waist, and then outside.
Outside.
So it's a dumbbell tumor. Okay? Now, let's see the T1 facade. Do we have anything recognizable here? Well, this is the lesion. And you can see the hemangiomas are completely suppressed, as we expected. Now, what we need to do?
Contrast.
We need to give contrast to see its extension and its enhancement. And this is T1 post contrast. What do we have here?
It's enhanced.
It's اوقف خلينا نكبر شوية. And وين هذه؟ Now, what do we see here? First, we see enhancing lesion, markedly enhancing. Extradural or dural based at least. It's a dumbbell shaped. It's squeezing through the exit foramen into the paraspinal region, right? And now, if you look carefully, you can see this little bit of extension. Let's see this one. This is I think sagittal post contrast, if I'm not mistaken. Okay. Now, here it's very typical. What is this?
Dural tail.
It's a dural tail. Okay? So, in combination, all of these, you have dural lesion
Homogeneous.
that is iso on T1, hyper on T2, enhancing, extending through the exit foramen with a dural tail sign, results in it's a meningioma. So the trick here is to distinguish that this is a meningioma and very close to it is hemangioma. There is meningioma and hemangioma. Hemangioma is asymptomatic. This is just accidental. We need to distinguish this. This is different from the other one. The hemangioma, it's the one that is causing the symptom. It's causing compression of the spinal cord. It's causing the neurological presentation of the patient. Meningioma is enhancing or not enhancing? Enhancing. Homogeneous, vivid, light bulb, intense enhancement. But conventional angiography بالكاف, what is the description of the enhancement of meningioma in the brain or in the spine or everywhere? اكو له term ما تنسى عمرك كله. light bulb اكو له sign. شو يسموها؟ يسموها mother in law sign. تعرفون mother in law؟ حماتك أم مرتك. ليش سموها mother in law sign؟ She comes early, she leaves late. تجي من وقت وتنام على قلبك.
يعني قصدك الفينوس يعني قصدك.
Enhancement early and stays. بالمننجيوما. It comes early and it goes late. Okay? mother in law sign. هاي ما ننسى. Okay? طبعا نفس الشيء بالنسبة للنسوان أم رجل تجي early وتروح late, يعني هي شو نقول vice versa. Other differential diagnosis, what? Schwannoma is possible. Neurofibroma is possible as a dumbbell tumor. Yes, definitely. However, these schwannomas and neurofibromas, first of all, they don't show the dural tail sign. First. هلا يعني هلا ما بيها dural tail sign. First. Second, they tend to be purely extradural, more than dural based. Mostly extradural. Okay? على الاكزيت foramen. طبعا definitely هو جزء من الديفرنشال diagnosis أكيد. If you see this or similar lesion in a peripheral مثلا بالثاي فرضا بالثاي شفت lesion بالsoft tissue from the nerve with the same criteria. Okay, this will be most likely شنو schwannoma neurofibroma nerve sheath tumor. Okay, to confirm what do you do؟ لا تسوي له FNA، تسوي له FNA بالبريفرال. اوكي ايش راح يصير؟ it will be severely painful. يعني FNA بسيط the patient will be in severe pain. ليش؟ لأنه you are pricking the nerve. اوكي يعني بشكل غريب انه painful اكثر من ال expected. يعني كنا نسوي FNA كل يوم little bit painful، بس اذا nerve sheath tumor لا راح يكون very painful. So when you have a mass and you prick it and it's more painful than you expect, keep in mind possibility of a nerve sheath tumor. Okay, بحيث يقول لك يعني you cannot do it without local anesthesia. You have to give some local to confirm, to make the FNA. Okay, good.
Was meningioma?
Yep. زين نجي على رقم 5. That's it. Thank you very much. دي يلا مو المننجيوما تعال باعتبار شو نقول ها this is easy case. Yes, 93-year-old female patient presented with vaginal bleeding.
Female?
Yes, 93 vaginal bleeding أكيد female.
ايه female لا خوش.
تمام. So يلا احكي لنا.
started with the coronal view of the T1.
Of the
T1.
no
T2.
T2
اعتيادي no fat cell.
T2 weighted images
Yes,
showing
showing there is a overall the picture. If you look to the uterus, within the uterus there is a hyperintense lesion within the endometrium extending to the internal pose to the cervical region also.
okay
And,
cervical مو
cervical.
cervical
Yes,
ذاك
yes,
neck.
cervical region.
Okay,
Okay. This is the not invading the surrounding like urinary bladder, and if you come down again, this is fibroma, fibroid from outside.
زين ليش ما تشوفين غير sequence
Yes.
ناخذ more information.
T2 fat cell I need.
هذا T2 fat sat axial T2 weighted images fat saturated showing
Also showing the hyperintense signal not suppressed by the
but
fat.
just one second, let's go to the sagittal, maybe it will be more informative in this case.
Okay. What is this? Okay. This is uterus,
Okay,
and this is fibroid, I think.
it's most likely
Fibroid,
as
maybe
what
it's serosal fibroid.
subserosal or serosal fibroid. Good. Hello, عليكم السلام ورحمة الله.
And multiple cystic like signal shadows within the endometrium are extending to the cervix also. This hypersignal not suppressed within the fat cell. This age 93 years old female, maybe polyp, maybe endometrial carcinoma.
زين. What do you need more?
I need contrast.
Okay, let's give her contrast.
Although T1 is better.
هسه شو تريدين؟ T1 لو contrast لو شنو؟
T1.
T1 هذا T1.
Yes, this is what was fibroid also. Also there's hyperintense signals.
What does this hyperintense signal mean?
It is T1, it is blood.
It's blood.
And it is
there is a
center
lesion.
of the lesion is also hypointense in comparison to the T2. We see it hyperintense.
So
So it is, I think, malignant. Maybe.
خلينا نشوف كمان تعطين كونتراست ونشوفين.
Contrast نشوف يلا.
خلينا نشوف contrast. When in contrast, let's go to this. This is contrast. T1. 93 years old. شوف first of all,
Yes.
common is common, rare is rare.
Yes.
القاعدة the golden rule.
Yes.
Okay? 90 years old with vaginal bleeding is endometrial carcinoma till proven otherwise.
Because of
قبل لا
the-
نصور.
Yes.
يعني we are not doing the image to confirm presence of endometrial carcinoma. It is endometrial.
We look to
Without-
the extent of the lesion.
لا imaging ولا بطيخ. 90 years old with vaginal bleeding. انتهى الموضوع. Okay, and in history it is diagnosed. We are doing the imaging for local staging to
Yes.
see is the tumor extending to the adjacent structure, is it invading the junctional zone, the myometrium, the perimetrium, or not? Is there a lymphadenopathy? Is there free fluid? Will she get benefit from hysterectomy, or she needs to have chemo and radio and things like that?
Yes.
Okay? So, first of all, this uterus is way too big for 90 years old. 90-year-old should have a very small, tiny uterus, atrophic.
Yes.
Tamam? She's 90. First. Second, uterus in a 90-year-old with fluid signal intensity
Yes.
in the endometrium, it is definitely abnormal. Let's see. T2. Let's go to the T2. Fat suppression or T2 احتيال, doesn't matter. You can see fluid signal intensity within the endometrium, and it's a thick one. Second. Third, the aim here is for local staging. Is the junctional zone intact or not? No, it's not. You can see it here, it's present, while here it's missing, and here it's missing. So this part of the junctional zone is invaded. The important thing, طبعا, this is just a subserosal fibroid, don't worry about it. It's expected at this age, okay? It's a subserosal fibroid. There is invasion of the junctional zone. Now, go to the fat suppressed, T2 fat suppressed, see the surrounding tissues. Are they invaded? There is small amount of free fluid here and there in the pelvis. However, the surrounding tissues are, the fat looks good. It's not stranded. No signs of edema. So probably it is within the uterus. Okay? And now if we give contrast, let's see, this is a T1 fat saturated post contrast, and you can see, well, it's not very nice image. Let's see, what about here? You can see this thing here, enhancing, pedunculated, bulging into the where? Into the endometrium. So this is a typical endometrial carcinoma till proven otherwise. Okay?
What were the fluids surrounding the uterus and the cervix?
Just free fluid in the pelvis, reactionary or malignant, I don't know. They have to remove the uterus or send for cytology.
Maybe fistula.
لا, fistula.
Why it's not pedunculated fibroid?
Which one?
Within the
The
endometrium.
fibroid.
The serosal fibroid or the endometrial one? What are you talking? Which one you mean?
No, the subserosal.
Yeah, it is a pedunculated fibroid. It is serosal pedunculated fibroid. It's not torted, it's just pedunculated.
بالنسبة للديفيوجن ما يفيدنا؟
Diffusion ما يفيدنا. شنو يفيدنا؟
يعني مثلا كانفيجن او كاكستنشن او
ممكن إذا if you are suspecting invasion to the perimetrium, to the fat surrounding the uterus, diffusion will show some edema or restricted diffusion بال fat. But we don't have any suspicion. There is no lymphadenopathy. There is no metastasis. The bladder looks good. The fatty tissue surrounding the uterus looks good. So basically, diffusion will give you nothing here. However, you can do it. It's Just a sequence will take 2 minutes.
staging.
You have local staging and you have staging in general. Local staging, you do MRI. Staging, you do chest, abdomen, pelvis, CT scan, looking for metastasis in the lung, in the liver, in the lymph node, and so on.
Hormone replacement therapy goes like this picture in enlargement uterus and
Hormone replacement,
increased thickness of
yeah, hormone replacement therapy will give you a normal appearing uterus in a postmenopausal female, like someone who's like 55, 56, up to 60 maybe. The uterus looks normal, the ovaries looks normal, there are some follicles here and there, endometrium is good, but the patient is menopausal. Okay?
What do you give this staging for this stage one?
It's invading the junctional zone, but not the perimetrium. 2 T2 or T2 T3 يعني. It's not invading the surrounding. She will benefit from hysterectomy if she do it. Okay?
Okay, thank you.
Hello. زين. يلا. يا شو وقت امتحانك؟
11.
يلا هانت. سهل لو صعب شو تريدين؟
فالدكتور يعني هسه انا صايره
عادي يعني
يعني ننزل المعنويات لو نصعدها.
لا صعدها مو
صعدها؟
ماشي
ماشي. مو ايه خربانه من قاعد المعنويات.
من قاعد
ست. يلا ماشي.
بس العفو بالنسبه للستيجنج
ايه
الستيجنج if it is within the uterus I think it's one.
حسب invading junctional zone or not.
ايه
يختلف. If it's not invading the junctional zone, it's 1. If it's invading the junctional zone, it will be T2. If it's reaching the serosal, it will be T3. Extraserosal extension, then it will be 4. Okay? Now, this is a male patient. Just let me see. He is 20 something, 22, 23 years old. Basically, he's asymptomatic. He just have attacks of tachycardia. Non-smoker, very healthy. Everything looks good. So, he was set for a chest X-ray. طبعا this is not the chest X-ray. This is what? Scout or survey of a CT scan. Let's take it as a chest X-ray. What do you see?
frontal chest X-ray of an adult male
Okay.
showing bilateral hilar shadow.
طبعا of course because this is a CT scout, the patient is not erect, he's supine. Okay, so يعني you have to treat as a supine X-ray, يعني elevated diaphragm normal, شوية widened heart normal. زين.
Lung fields are clear.
Okay.
In the right lower lobe, you can see like a vessel.
Excellent. Beautiful. Love it. Continue.
And is it scimitar?
Describe first.
Okay. So there is an vessel-like shadow extending from the lower lobe and passing the diaphragm down to the liver.
And the thing is, as it goes down, it becomes bigger or wider.
Yeah.
Okay? So, what would you like to do?
Further to see
Sorry?
angio.
Give contrast. Make CT angio. Let's see if we have the contrast. This is the contrast image. Scroll. عندك الستيرن. Tell me what's going on. So, what do we have?
Dome of the liver. Here.
Okay.
This one you have a vessel
Mm-hmm.
extending up.
Arising from where this vessel?
Portal is very
sorry
Portal or inferior canal.
مو portal or اختاري واحد portal or inferior. What vessel is this? Ivan,
Inferior.
this is the IVC. So it's arising from the IVC. Okay. And it is coming from the lung.
صح.
Okay. Now, if you want to have better appreciation, you need to go for what?
Corona.
Corona. Yeah, راوينا.
إيه.
So you can see this is an anomalous vessel, okay, arising from the eye or draining into the IVC. حتى واحد يكون أدق يعني draining into the IVC and it's coming from the lung. تمام? So this is called what?
Scimitar syndrome.
Scimitar syndrome. What's the scimitar?
لا الفأس هذا اللي أبو ذو الحدين.
It's a Turkish sword. اللي هو يكون الايدج مالته عريض نهاية عكس السيف مالتنا. السيف مالتنا الايدج مالته رفيع. ذاك يصير بالعكس رفيع من جوا وعريض من برا. بالضبط هيك اوكي. فهذا سميتار مثل هذه من جوا يكون عريض ومن فوق يكون رفيع. اوكي. It's kind of a sword. What's the scientific name of this? Scimitar syndrome equals what?
Total anomalous.
Partial anomalous. Partial anomalous venous pulmonary venous return. Okay. ليش مو total?
إذا total يعني
First, we said the patient is asymptomatic. Okay.
cyanotic lesion.
Total, he will be in. He will not reach 20 years old. He'll die when he's like mendal يعني kid, infant. Okay, because there's a total anomalous pulmonary venous return. Presentation of partial anomalous, most likely it is accidental diagnosis. Patient might have some tachycardia, some weird feeling خلينا نقول in the chest. Okay, he feels something not correct, but nothing else. Okay, most likely it's an accidental, and this was an accidental diagnosis, by the way. Okay, this case was just a totally accidental diagnosis. Patient has nothing. What's the treatment? Nothing. Just send him home. Maybe follow up by echo every now and then. Okay? So this is a partial anomalous pulmonary venous return, also known as scimitar syndrome. طبعا the draining vein can drain into the IVC, can drain into where? بعد. No, النورمال انه البulmonary vein drains to where? To the left atrium. This is a normal thing. It's this anomalous. So it can drain into IVC, like here, can drain into right atrium, can drain into portal vein. All of them are parts of partial anomalous pulmonary venous return. Okay? ممكن بالاتريوم، ممكن بال right atrium، ممكن بالاي في سي، ممكن بالportal vein. Okay? Any question? Thank you very much.